Welcome to the second bite-sized session on self-evaluation. In our previous session, we introduced this document, which shares the quality illustrations relating to Key Question 5. We looked at what self-evaluation is and started to consider how you can join together the work you are doing with best practice guidance to ensure you record a truly reflective and evaluative summary. The document supports you to complete your self-evaluation using 3 questions. These are: how are we doing? How do we know? And what are we going to do now? Against each of the 3 quality indicators. The quality indicators relate to children's health and well-being, infection prevention and control, and staffing arrangements. We are going to take each question in turn and share examples, starting in this session with how are we doing? This question should help you identify your service's strengths and begin to consider possible areas for improvement. We're going to look at examples in relation to the quality indicator 5.1. This is: how is children's health and well-being supported and safeguarded during the COVID-19 pandemic? But we'll use this to help us understand how we can answer the how are we doing question. However, it doesn't matter which quality indicator you are evaluating, you can apply the same process. How are we doing is key to knowing whether you are doing the right things. Think carefully about what the quality indicator is asking you to consider, and make sure you've addressed the key points which have been asked. This question should help you identify your service's strengths and begin to consider possible areas for improvement. Ask yourself, what difference are you making for children and their families? Can you see the impact of your work through children and their families experiencing high quality, safe and compassionate care and support? Is this tailored to their needs, rights and choices? When you are evaluating how are we doing, consider, do you understand how good your service is and the impact it is having on the lives of children and their families? In our previous session, we talked about applying the so what question. After every statement you write, step back and use it to consider the value of what you have written. Is the impact of your actions clear? In our first session, we gave this statement as an example. This is an evaluative summary of the range of activities which we undertook. In the following slide, you can clearly see the wide range of elements which have gone into us coming up with this evaluation. On each slide, you will be able to see which part of the statement the actions we have taken directly refers to. These have been highlighted at the top of the slide. As we go through the next 6 slides, we will give you some time to read through the statements for yourself. Sometimes there have been quite a few actions for a small part of the statement. A key skill of evaluative writing is being able to summarise what you have done and what this has meant for children, without providing all the inputs that have gone into making this happen. The health and social care standards underpin your practice. These are some of the standards which relate to the evaluative statements which we have made. There are lots more. Consider the relevant best practice documents underpinning the work you are doing. These are the best practice documents which we feel relate specifically to the statement we have made. I am sure there are others you can think of which impact on our statement and your practice. Using the most recent Scottish Government guidance on the reopening of ELC services, it is easy to see how our evaluative statement has taken account of this and reflects it. When answering the "How are we doing?" question, ensure you maintain a clear focus on the impact on children, their families and staff. Remember to always ask the "So what?" question. This will help you to clearly demonstrate the difference you are making to children. The same process is followed throughout all the self-evaluation. In the next session, we will look at the next question: how do we know?